Hello everyone, I'm Dr. Tanya Das, infertility and IVF specialist at IHR Kolkata. And today we'll be talking about azoospermia. So when we talk about azoospermia, the first question arises, what is azoospermia? So if there is no sperms in your semen sample, we say that it is azoospermia. Now, how do we diagnose azoospermia? It cannot be diagnosed based on one semen analysis. You have to have two semen analysis at least 15 days apart, and both the semen analysis should have the similar parameters, that is no sperms found in the semen sample, and then only we can diagnose that you are suffering from azoospermia. So how common is it in our population? When we talk about general population, around 1% of all males suffer from azoospermia. And when we talk about infertile males, out of all the infertile males, only 10 to 15% of all infertile males suffer from azoospermia. Coming to the causes of azoospermia, we all know that sperms are formed in the testes. So when we divide the causes, we divide it into three different parts, that is pre-testicular causes, the testicular causes, and the post-testicular causes. When we see the anatomy and when we see the physiology, that is, there is hormones secreted from the glands present in the brain which acts on the testes, and then testis produces those sperms. So if there is any deformity, that the hormones which is to be secreted from the brains are not produced and it is not acting on the testis, so the testis does not produce sperms, then it is pre-testicular causes. That is, there is some defect in the hypothalamus or pituitary gland which is not producing FSH and LH. These are the hormones which are responsible for producing sperms in the testis. So what could be those causes? Any tumors in the brain, any tumors involving those glands in the brain, any radiational exposure to the brain, chemotherapy, or it could also be because of anxiety and depression. Coming to the testicular causes is that there's some defect within the testis, that the testis is not able to produce those sperms. So it is an intrinsic testicular defect. Now it could also be because of radiation exposure, could be because of chemotherapy, could be because of infectious causes. Also, one of the most common causes is undescended testes. So if undescended testes was there during your adolescence and then it was operated and brought back to the scrotum, though it was brought back, the testis has already suffered the damage it had to, and hence it is not able to produce the sperms. Also, varicocele. Varicocele means the veins around your testis, they have enlarged. So the temperature of the scrotum is not maintained and the testis is not able to produce sperms, and hence it leads to azoospermia. So coming to post-testicular causes, what happens is the testis produces the sperms. From there is a duct which brings back the testes through the penis outside. So if there is any obstruction to that duct, then there is azoospermia. In these cases, the sperms are being produced in the testis, but it is not able to come out through the semen. These are the post-testicular causes. So, is this azoospermia treatable? Yes, it is treatable depending upon the cause. Now, if it is pre-testicular and if it is because of any radiation, chemotherapy, anxiety, depression, we need to treat those conditions. When the condition is treated, the azoospermia is treated itself. Also, what we can do is we can give you hormones, FSH and LH, can be given as injections, and then the LH FSH acts on the testes to produce testosterone and after that sperms. Coming to testicular causes, again, if chemotherapy medicines are removed, if the infection is controlled, the sperms can be found in those cases. And in post-testicular causes, surgery can be done to remove that obstruction in the duct, and then azoospermia can be treated. The semen would have the sperms from there. Other than these, there are surgical options as well. Mostly we do those in cases of obstructive azoospermia, that is when there is an obstruction to the duct. So if the surgery is not helpful, or if the patient does not want to undergo surgery for removal of the obstruction, what we can do is we can do a very simple procedure, that is TESA, PESA, or micro-TESE. During this procedure, we can take sperms directly out from the testis and do ivfXC with those sperms. So there's nothing to worry. Almost 90% cases of azoospermia can be treated and you can have child with your own sperms. Rest assured, in less than 10% of the cases, we do use donor semen, and hence a child can be born through it. To know more about azoospermia, you can always log on to our channel and contact us at our center directly. Thank you.